Everyone, just a quick one on fillings. So if you've been told you need a filling, I think the first question to ask is where is it on the tooth? If it's on the occlusal or biting surface, you should literally be able to see a cavity or at least a shadow on the enamel. The trickier ones are the ones in between the teeth. So usually these are diagnosed on a bite wing X-ray, and this follows a classification system called the RA classification system. RA1 or 2, you should definitely watch. RA3 is something that is a maybe. RA4, 5, 6, you should definitely fill. There's much more detail in my blog, so check it out. Everyone, let's talk about dental tourism. This is one of the biggest trends in dentistry where Australians, Brits, Americans have no choice but to fly to neighbouring countries for comprehensive dental care. The reasons are pretty obvious. There's very little federal support for comprehensive dental treatments. And even if you have health insurance, they have maximum annual limits. So if you need like a 5,000, 10,000 plus dental treatment, your insurance might, cover $1,000 or 1,500 or something. So this leaves like people with very little choice if they need a really comprehensive plan. So it's not an irrational thing that people are considering. So what are the main concerns I have with overseas dentistry? I think one is the compressed timelines, where for good work, for implants, for crowns, you sometimes need weeks or months. It's not something you can pack into 5 days or 7 days. The irreversibility also bothers me, the fact that often these treatments, because they're compressed, they make the treatments more invasive. They do crowns and, implants instead of more conservative care like orthodontics and tooth whitening. The other thing is the accountability. What happens if something goes wrong? We see this all the time. I probably see this a couple of times a month where something comes back and then it's like, okay, I don't even have the parts for this. I don't even know what implants they use for this. So it's a real concern. If something goes wrong, who is going to manage it? There are certain times where I'm like, this is too much risk for me to take because this is a botched job and I don't really want to have my name associated with this work. So there are occasions where I turn people away because it's just too much risk for somebody to take on an already complicated case made worse. So these are some of the considerations. It's a complex topic. I think the 3 parts of the solution is 1, try to get more federal funding into dentistry so people don't have to make these desperate choices. The second part is real focus on prevention, where we want to try get avoid people from getting into this in the first place. And probably the third part is just like having genuine conversations with your dentist around payment plans and triaged, staged sort of managing over multiple years rather than having a 10,000 or 20,000 bill all at once. Anyway, read my blog. I think it's got more detail and reach out any